And booster shots are becoming a serious discussion as the Delta variant drives a summer COVID surge. Now, the surge is largely affecting the unvaccinated, but Pfizer now says new data shows its vaccine's effectiveness goes down after 6 months, making the case for booster shots. This is 45 states are seeing an increase in COVID hospitalizations. Trevor Alt has the latest.
Overnight, Major League Baseball postponing the Nationals-Phillies game because of a COVID-19 outbreak. 12 members of the Nationals testing positive, including 4 players. The team's manager saying he believed only one of them is unvaccinated.
I'm very concerned. I really worry about the health and safety of everybody, in our clubhouse.
With more breakthrough infections making headlines, Pfizer now calling for booster shots. The company revealing new data showing after 6 months, their vaccine's efficacy against COVID dropped from 96% to 84%. And that data comes from March, before the Delta variant became the dominant strain. Michael spoke to Dr. Ashish Jha about booster shots earlier this morning.
The vaccine, even 6 months out, has incredibly terrific protection against severe illness and hospitalizations and deaths. Now, that was before the Delta variant hit. We don't know how well it's going to do 6 months out. So I think we just need a little more data. But I certainly don't think everybody should be going out and thinking about booster shots. I think we're far away from that right now.
And health experts have noticed as cases are climbing, vaccinations are also rising as well. We saw almost 500,000 people get their first shot on Wednesday. That's the highest number we've had since the 1st of July. And Diane, we should also mention the CDC has changed their recommendations for vaccinated people. They say they should get tested and self-isolate after any potential COVID exposure. Diane?
All right, Trevor Alt in Tampa, Florida. Thanks, Trevor. And let's bring in Dr. Alok Patel, physician at Stanford Children's Health, for a little bit more on this. Dr. Patel, thanks for being here. Let's start with this Pfizer vaccine data that we just heard about in Trevor's piece. They're showing its vaccine efficacy dropped from 96% to 84% after 6 months. So what do you think? Should people who got vaccinated 6 months ago be getting boosters now?
Good morning, Diane. I agree with what other public health experts are saying, and it is too early to recommend for everyone out there to run out and get a booster shot. You mentioned the word efficacy. That is a lab term. In the real world right now in the United States, we're still seeing a high level of protection, an incredibly high level of protection against hospitalizations and deaths for those who are vaccinated. Now, the jury is still out right now on what's going to be recommended for people who may have had a lower than robust response when they first got vaccinated, including people with underlying medical conditions that could affect their immune system or the elderly. But everyone else out there, no need. We just need to make sure that we get the original vaccines out to everyone.
So if we don't need booster shots after 6 months, do we need to start taking more precautions after 6 months?
Well, we need to start taking more precautions because the unvaccinated are propagating the spread of the Delta variant. I don't necessarily think this is just because of a theoretical waning in the protection from the vaccines. It's because there's a lot of Delta variants in the United States. We're seeing uptakes in 49 or 50 states. And like I mentioned earlier, it's really being spread by the unvaccinated. And right now, we still don't know to what degree people who are vaccinated can transmit the Delta variant because it carries a much higher viral load than the original Alpha strain. So I'm less worried about vaccinated people themselves getting hospitalized or severely ill, and I'm more worried about us transmitting to those who can't yet get their vaccines, like young children.
So the data for this study also ended in March. That was before the Delta variant became the dominant COVID strain. So how valuable is this information?
So I think it's valuable in the sense where over time, antibody responses to vaccines do wane. We know that. That's why in the real world, there are boosters indicated in certain situations. But Diane, it's important for people to understand that there's two arms to the immune system. There's the antibodies. There's also the memory of the immune system as well, which will be able to reproduce more antibodies in the future. So it's hard to take that data from March and then just make an end-all be-all rule with it. But I agree that there is something to pay attention to when it comes to the Delta variant and a more contagious strain, because even if your protection, let's say, say it's 85, 90% you're vaccinated. If you get pummeled with 1,000-fold more virus, it's possible you could get infected and spread it to somebody else. So it's something to pay attention to.
And the CDC is also now saying that people who have been fully vaccinated should get tested after exposure. Even if they don't show any symptoms, they should also mask up in public indoor settings for 14 days after potential exposure until they receive a negative test result or until 14 days is up. So what are your thoughts on that? And I just wonder if you worry at all about people who are already vaccine hesitant hearing all these new rules and saying, well, then what's the point of being vaccinated?
My first thing that I want to do is bang my face on the table out of frustration because we shouldn't be at this point right now. Now, I understand why the CDC has to be a little bit more conservative and make a general recommendation for everyone out there. I think it's up to states and local governments to say, like, hey, vaccination rates are a little bit lower here, or transmission is higher, so take a little bit more precaution. And that's also going to affect, what your level of exposure is going to be if you are vaccinated. And I agree, when we're making blanket rules like this, I worry about people who are vaccine hesitant thinking like, hey, the vaccine may not work, or what's the point? Or when we don't differentiate between a breakthrough infection versus somebody unvaccinated becoming very ill. Again, people may think the vaccines don't work. That's absolutely not true. Still, above 95% of people hospitalized in this country from COVID-19 are unvaccinated. That needs to be the take-home message.
So even with the Delta variant, those of us who are vaccinated are still largely protected against getting COVID, almost entirely protected against hospitalization and death, and less likely to spread it. Is that right?
Well, it depends. So, Diane, I just want to differentiate one thing really quickly. We are very well protected against getting severe illness or hospitalized. Now, when you say getting COVID, it's possible you could test positive for coronavirus and be vaccinated because the PCR test is looking for viral sample, but you may have no symptoms. That's fine. That's proof that the vaccine is working because that means that you had some viral particle in your nose or in your mouth, but your immune system was like, not today, dude. And it worked. That's okay. So it's okay to have an asymptomatic breakthrough infection. And there are people out there who are getting mild infections from COVID-19, just like any other cold, but they're not getting severely ill. That's what the vaccine promised. That's what it's still delivering.
Not today, dude. I love it. Dr. Patel, appreciate the explanations as always. Thank you.
That's the vaccine theme. Not today, dude. Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.